Hi, I'm Evan Pantazzi, and I'd like to welcome you to the Kyusho explanations for this DVD. Today we're going to take a little bit of a departure. We do Kyusho pressure points for martial arts as you've known, because we've gone through 17, 18 DVDs already. What we want to do today is we want to show you revival methods and healing techniques. Now, we do healing all the time. It's like shiatsu or acupuncture. But what happens, what the difference is with Kyusho is we developed a more immediate need. If someone comes in with a headache for a shiatsu treatment, you can take a longer period of time doing a nice full body massage, or with acupuncture, you can stick the needles in and leave them for 15 minutes while the person cures. Well, when we're doing Kyusho, we develop instant pains or instant problems in the body, like a headache or nausea, or the bronchial tubes contract, like an asthma attack. So we've developed first aid to eliminate these problems in our partners. And in doing so, we found a quicker and more immediate way to relieve common ailments, like the headache or asthma. And that's the gist of today. But today we're also going into a historical look on how we developed these healing recipes. And again, they were developed out of the immediate need for once we used Kyusho in a martial aspect and inflicted some pain or some dysfunction on the individual, we needed to know how to correct that. And in the process, we learned how to cure things like sore throats or hiccups in a much faster manner. And that's going to be the Kyusho First Aid. One of the first revival techniques you saw all the way back to DVD number 1 was one for a lung revival. And it was on a point called the large intestine 10. If you remember the DVD, we had that pressure point right between the two muscles in the arms. Now it causes dysfunction, but at the same time it can cause revival, a restoration of a health aspect. This, for some reason, this nerve connects into the body at cervical vertebrae number 5, where the phrenic nerve also emanates to come down to the diaphragm to make the diaphragm contract or expand to help the lungs breathe. Okay? That's why we did this as a lung revival. Now, how we found it is we actually caused a problem with the diaphragm. And through searching and knowing that when we struck this as a technique of a martial technique, we'd know it would make the person have a harder time breathing. Okay, and if we used it in an opposite way, we also learned that it could help the person if we did stop their breathing or cause some sort of dysfunction in their breathing, we could relieve it, right? And I'll tell you some healing recipes that go with this afterwards. But unfortunately, I'm going to cause some disruption in the person's breathing. First, to show you the point, there's a pressure point inside of the ribs called spleen number 21. Spleen 21 is halfway between the armpit and the base of the ribs, okay, directly in the middle, and halfway from front to back. I'm going to strike this just to cause a little toughness in breathing first. Take it. Yeah, okay. Now what I do is I pull on this point. I massage it and draw it down. And you can tell that already his coughing and his breathing issue has subsided. Now, what we also found out by just doing that simple recipe, doing this double approach, the yin and the yang approach, we also found out that when a person, say, has hiccups, okay, their diaphragm is in spasm. And we thought to ourselves, well, if we can spasm the diaphragm and then heal it, if the body automatically goes into hiccups, which is just automatic spasming, why can't we heal it as well? So just this simple exercise of drawing down on the large intestine 10 can help with a person's hiccups. All right. Now, Ben just had a newborn baby, and we congratulate him. Okay. And could you tell your story about the hiccups with your newborn child?
I was trying this technique on my newborn baby, and I realized in the first 1.5 months it did not work. I think through different reasons. The arm is very, very small. But now when my baby has hiccups, I use this drawing down technique on large intestine 10, and it works wonderful. When after drinking she gets hiccups, I can release this with this technique.
Yeah. And this is the value of Kyusho for us. Yes, the martial arts is a lot of fun, It's an amazing thing as we go back in history and we see what the old martial arts were really intended to do. But the real beauty is in the duality of it, the yin and the yang, again, like we were mentioning. You have the healing qualities. And the healing qualities is not just for something we do in the dojo or in the mat. We can take these healing aspects back to our loved ones, our family, our friends, and help them. Hiccups is a tough problem for some people. They have chronic hiccups. This is just one idea on how to calm those. Later on in the DVD series, you see us doing another type of a lung revival. And this confuses people in the beginning because they thought that this was our lung revival. And yes, this is. Okay, as a matter of fact, this we used quite a bit in the beginning. But we developed more immediate needs, and therefore we needed a stronger recipe. By the way, before we go on, I do want to mention that we said that this works for hiccups. But this is also invaluable for any kind of sports. Soccer players, basketball, volleyball, whatever sport you're in, athletes invariably at some point in their career get a stitch in their side. The stitch in their side is because the heavy breathing causes the diaphragm just to spasm or to cramp. Okay, and this healing recipe for the hiccups also relieves the stitch in the side that people commonly have, even children in the playground, from running too much. All right, so again, these recipes can go in many different areas. Now, the recipe that I'm going to work with Zavi right now is in 2 pressure points called spleen 17. Now, just like we were mentioning with the hiccups, okay, the hiccups on the newborn baby is very difficult here because maybe the father or the mother's thumb is too large to get between the muscles. Maybe the baby's nervous system isn't as developed as to have that nerve that is sensitive, okay? But what we found to relieve hiccups, okay, is this intermediate lung revival worked very well. On a newborn baby, because they're so small, sometimes you can just rub their chest outward, and that will also calm the diaphragm or the hiccups. Also, sometimes a little coughing. If you see the baby really having some trouble with the chest or the abdomen distending, you can calm it just by pressing down on these points. Before we go into the technique, the pressure point is right at the base of the breast line. Right underneath the breast line, over to a 45-degree angle. Now you have to push the nerve up and in at a 45-degree angle. If you could sit on the ground for a second. The way we do this, if we have a person that's had a severe problem with their breathing from the diaphragm attack, what we do is we stretch out the rib cage and place their palms flat onto the floor. That stretches out the ribs. At that point, I want to strike both the points simultaneously up and in at a 45-degree angle like I'm coming in toward the lungs, which makes the diaphragm spasm, okay? Now that, since he was breathing normal, had an adverse effect, okay? Come on up. Okay. Now, I'm very sorry in advance. Okay, what we're going to show is I'm going to show a technique that you'll see on a prior DVD. And what it does is it's a harsh technique. It's a hand posture technique out of the 6G hands. But what it does is it arrests a person's breathing. So you'll see a real need for the breathing technique, and then you'll see it done in real action. So the technique... Thank you. You can see that just by doing that one technique, you okay?
Yes.
Okay, arrested his breath. Now he was coughing, but what was happening, if you listen carefully back to the tape, you'll hear the air come out of his lungs, but nothing was coming back in. All right, so for some reason it was the diaphragm was spasming or expanding in such a way that it was pushing air out in the cough, but it wasn't coming back in as easily. So what I did was I struck those 2 points to allow the diaphragm to relax, okay, which again got him in a normal state of breathing. Okay, that's the value of this, and this is why we found this technique out of more urgent need. One of the other revivals that we developed, and this one is quite controversial, was the heart revival. Now, we didn't do that because we stopped people's hearts, although some people have been reported, even EMTs in emergency situations, to use this to restart from heart attack, but it's not what we have done. We've never stopped hearts to restart them, okay? But what happens is you have such a constriction in the chest, okay, that we have to release this somewhat. Now, the technique, if you could turn to, if you remember from the first DVD, was on the bladder 13, 14, and 15 is the most important point for this heart revival. It's right where the scapula ends, and midway between the spine and the scapula itself, there's a pressure point that when you push up and in, it causes a little pain, but when you strike it, it sends an electrical shock through the chest. Okay? So one of the ways we found this is a very sensitive pressure point on the nipples. It's called stomach 17. In fact, in acupuncture, it's one of the forbidden points. Okay, why it's forbidden, nobody really says, but if it's forbidden for a needle, we figured, okay, we might as well test it with striking to see if it's a good viable target, and it is quite efficient. All right, by striking into the nipples at a 45-degree angle toward the center of the chest, you can cause a lot of dysfunction. You can see how the body folded up into a fetal position. You okay? You with me? I'm good. Now, why I'm tapping him over here is he's coughing just a little bit as well. But if you rewind the tape, I'm sure you're going to find that he did not fall down. He jumped up into the fetal position and fell out of that position. All right? So I'm going to ask you to just turn. Stay seated, but just turn and explain what happened.
You hit, everything just went dark.
Where'd you feel it?
Right in the center.
Okay.
Everything just, I know I felt that closing in and didn't feel good.
Yeah, it didn't look like it, didn't sound it either. Okay, but what happened is you saw his body contract into that fetal position as I mentioned, but when I struck him on the back, you saw his body flail open as almost a yin-yang directive. It just did the reverse of what I did in the beginning to close it down. And that's how we went about calling this the heart revival, for a better way of saying it. I mean, saying the chest constriction revival, it's a little termy, so heart revival is just a little easier to say. And like as had mentioned before, we have had people in our organization that have used this quite effectively to save people in a heart attack situation. Something important you're going to see throughout this whole healing, and you've seen it through all the martial art aspects of the Kyusho and all the DVDs before, is when we do a revival, we always close up the legs, we fold the hands, we sit the person upright. There's a couple reasons why we do this, and it's actually quite an interesting phenomenon that happens with the body. The only way these revivals work fully and well is when we sit the person in this position. And I'm going to explain why. I don't have a true medical explanation. We have theories which I don't really want to get into, but I'm just going to show you the correct way and the wrong way, okay? And how we found these, again, by accident. Right. Let's take the intermediate lung revival that we had seen earlier. Okay, we had sat the person up, we had leaned them back and placed their palms behind them to stretch out the ribs. But it wasn't just to stretch out the ribs. It's very important that we do this with the palms down and the legs folded so it actually affects the body. Now I'm going to show you the technique. I'm going to tap so you see the results of this technique. Okay. It affects the diaphragm, it affects the breathing of the person. Now, seated this way, that works correctly. It will either disrupt the person's breathing if they're breathing normally, or if they're not breathing normally, it will correct the breathing. It's again that yin-yang duality, okay? But if his hands, could you place your hands upward? If his hands are not placed palm down on the ground, now I hit harder, but there's absolutely no effect. Okay, could you place your palms down? Just light, you can see that has the effect. I didn't want to do it hard again. Now, also the legs, if you could extend your legs, if we strike, nothing happens. Could you fold your legs once again? There's a huge effect, okay? Now, the reason why this happens, again, technically and scientifically, we have no idea.
We've talked to a lot of doctors and a lot of different scientists from different specialities, and nobody can really quite understand it. What we believe is that the body is in such a splayed out manner with the legs sticking forward as an example, that you have a lot of nerve on the floor, okay? And that is just like taking the energy and letting it go down toward the legs instead of staying into the diaphragm as needed. Once the legs are folded, though, it allows the energy to stay in the body more, okay, and it will transfer into the diaphragm more effectively. So these are some things that we've seen just through experience. These aren't not theoretical. We developed these techniques based on need, okay, and the immediacy of the need. And that's why the Kyusho healing techniques that we're going to continue on with are so impressive, because they heal in very short time, seconds as compared to minutes or hours. Now, I'm going to tell you about the healing of this technique first before I show you how we discovered it and how we found this for the first aid revival. Now, a lot of people get sore throats. We're filming this now, it's in the fall, the winter's coming, the air starts getting colder, people start getting raspy throats, sore throats, they get colds, they get sore throats due to colds, okay? To relieve a sore throat, okay, all we need to do is find a pressure point on the end of the thumb, right where the cuticle comes over to the side of the thumb on the outside. It's not on the inner side, it's on the outside. It's on the radial nerve, and what we need to do, it's called lung 11, is we pinch and hold this for about 15 seconds. And if you have a scratchy throat, or you're raspy, or even if it's swollen from the soreness, okay, this after 15 seconds will help you because it soothes it. If it continues throughout the day, at another period, you use the other hand and you just switch back and forth. Now, that's a good side effect or a side benefit of this technique. And if you think about it, if you get a sore throat, you either spray some chemicals into your throat, or you take a lozenge, a candy lozenge, and you just hope for the best, okay? Or you take some even stronger medication. Now, all of these cost a lot of money, okay, over time. And as you go back into it, when you start thinking about the way food is evolving in the United States or around the world, we're getting hormones in the foods, chemicals in the foods, people are taking drugs for every ailment around, when we used to do natural remedies like herbs, teas, things of this nature, okay? As we put these chemicals into our body, what are we doing to ourselves? We're not only spending money on these chemicals, but we're poisoning our bodies. This is a nice natural remedy that works in seconds rather than minutes that a lozenge would take. Okay, or the spray is maybe a little quicker, okay, but again, that's a chemical that you're inducing into your body. And as we go on in society, we're finding that these chemicals, over a longer period of time, have bigger ramifications on ourselves. So we want to find more natural remedies for these common ailments. Now, this also is an invaluable tool for someone that is nervous, okay, for public speaking engagement, as an example. When you go to speak in public, sometimes people feel the welling up into their throat, and they have a tough time swallowing, or they get dry throat, or they just get nervous and they feel their throat constrict. Or if you're having an emotional problem, you get choked up, you're ready to cry, your throat gets swollen. This is a way to calm that down, to open the throat, and it relieves the anxiety or the emotion that goes with it. So it works for public speaking, it works for emotional qualities, it works for sore throats. It's invaluable, and it takes 15 seconds. You can do this to a friend, a family member. You can do it to yourself. Now, most of these recipes you're going to see today, you can't do to yourself. Okay, for some reason, it doesn't work as well as when someone else does it to you. But there are some, like this one, that you can apply yourself that is extremely effective. All right. Now, how we found this is we found that when we hit any pressure point in the body hard, okay, the throat would swell. What we believe is everybody walks around, as adults anyway, we walk around with a lot of emotional things pent up inside of us. And when you get hit on a nerve, it's much like taking a massage. Some people that lay on the massage table break out into tears, or they break out into hysterical laughter because emotions are being released, because the nerves are relaxing and the body relaxes and lets go. Well, it's the same thing on hitting a pressure point. Okay? Say I need him in gallbladder 31. Now, in the beginning, we didn't feel this throat constriction because this hurts enough that you don't even pay attention to what your throat is doing. You're just thinking about the pain where your leg got hit. Okay? But after we started working on it, we noticed that everybody was just having tough time swallowing. They'd try to talk after the technique, they couldn't talk. And would find out that everybody had the same problem. Their throat would swell. They couldn't get the words out. All right? So this is where we discovered that we could eliminate that problem just by using this sore throat recipe. All right? Now, to effectively do this, now it's going to be hard for you to see this on the screen, but we're going to ask Gianluca to explain the feeling. So I'm going to ask Gianluca to swallow first. See what that feels like. Okay? It's not bad? Okay. Swallow. It's difficult?
Yeah, not easy.
Not-
Close.
Okay. So all I'm going to do is apply the lung number 11, 15 seconds or so. There's no designated set number. I could hold it longer if I wanted, but I'll let go maybe 10 seconds later. Is better?
Yeah.
Good, good. So it reduces the swelling. But the sore throat recipe, this is how we found it. By hitting the pressure points, closing the throat on the individuals, and finding a need or having a need to open the throat back up. We're going to go into another recipe right now. We found this again through our martial techniques as a need. Okay, what I'd like you to do right now is take a look at the coloration in Jamie's face. Okay, slight pink, but it's mostly white complexion, a pale complexion. Now, when I do this technique, what this technique does and how we found it is it causes anxiety in the individual. Okay, and what anxiety manifests in is you start tightening up in the shoulder and the neck region. Everybody's felt anxiety, so I don't have to tell you what it feels like. But you're going to see the coloration change. Now, how we found this was when we were doing our arm techniques, our arm destructions from the DVD number 2 that we produced. A lot of those individuals on that DVD used this recipe as they were sitting on the sideline waiting for their turn for the next showing. So what happened was they were correcting themselves. But we found this by striking pressure points in the arms. For some reason, that the pressure points in the arms cause a lot of stress. All right? So if I just tap lightly here, that causes a lot of pain. Okay? But now you're going to start to see, you can start seeing already as you focus in on his face, his color is already starting to turn a little redder in the face. Okay? And as we let this go, it's going to just keep manifesting. It's because his blood pressure rises a little bit, okay, and he's getting a little bit, sorry, can you explain what's happening?
Yeah, I feel a little sick in my stomach. It's moving up into my heart, it's coming up, I feel sweaty, I know when you did that, it went right up over my head and I just started to feel sweaty.
Mm. Okay, and you can tell if you turn sideways just a little bit, you can see the coloration on his face is coming up from this side in particular, but it's going to attack the sides more than the front, but you can also start to see his forehead especially is turning red. Now, I'm not going to let him stay in this state because you get a little antsy. Yeah. All right, the technique is right here at heart point number 3. Okay, what I need to do is this pressure point is in between 2 muscle strands. I need to push in and massage it much like I did with the large intestine number 10. And this will calm the body over time, and 30 to 60 times on this arm, I do it 30 to 60 times on the other arm as well, which I will as I'm explaining this. And this reduces the anxiety that he feels. It relaxes the upper chest, the stomach area, the head, okay? The coloration is just beginning to start. It's still a little red, okay? Are you sweating anymore?
No, I definitely feel a lot calmer. I mean, I just felt like it was swelling up in me and I was itchy and moving.
Good.
Well, not good for you, but good that you're explaining what was happening. Okay, and you can see already his forehead now is a white color as opposed to the red that it was turning. He's still got a little red on the side of his head, but it's calming down. Now, also what we found out is, okay, we can induce this stress feeling. Okay, we can induce this high blood pressure, or this anxiety in the person. Well, if it works for relieving him this quickly of his anxiety, what about someone that just has natural anxiety, or they've had an emotional event in their life that they've developed this anxiety, stress over their work, stress over family matters, stress over anything, okay? Or what happens if they don't sleep at night, insomnia? So we started working with this recipe on people with insomnia, the stresses, and different manifestations, and it seemed to work wonderfully. Again, there's no drugs involved. It takes 30 to 60 seconds on both sides. It's literally 2 minutes, and you can reduce his stress. This one you can also do it at home by yourself. You don't need someone else to do this for you. However, if someone else does this for you, it does have a more calming effect. But in the middle of the night, say you wake up at like 3 in the morning, you can't sleep, you have the insomnia, or you can't even get to sleep to get to 3 in the morning. You can massage this on yourself, and you can get a good night's sleep. We also found that this works with rashes. Rashes are also similar to stress, anxiety, insomnia. It's because maybe a plant material, a pollen, or something in the food you eat develops a nervousness or an anxiousness in your body. And it manifests in things like hives for food, for example, or poison ivy. When you touch poison ivy, some people, the pollen just doesn't mix with them and they get very, it agitates their nervous system. And because their agitated nervous system, it escalates the blood pressure. The blood pressure escalates and it turns into little bumps and manifestations where the blood raises the skin, okay, and they start to get itchy. Now for these, we found that this pressure point, the heart point number 3, works very well. But we need something to calm the body just a little bit more, because now it's not just an external stress. We need to go a little deeper into the body because it's affected the nervous system at a deeper level. All right? So if you could take a seat on the ground and lift up one pant leg. What we would do is we would start on this heart point 3 to reduce the stress in the body, okay? Reduce the anxiety, get the head calmer, get the chest calmer, okay? But this also starts to manifest when someone gets very itchy. They start to move their body in very strange ways. It goes right down to their legs. So we have to work on a pressure point in the leg. The most important pressure point that we start with is a point called spleen number 6. Right from the ankle bone, you place your hand here, and it's about 1 hand width up. Now it depends. Now if he's a larger individual, it would be the size of his hand, not my hand comparatively. All right, so you have to take that into account. He's my size, so I use my hand width. The pressure point is right behind the bone and in between the Achilles tendon and the bone. And you want to massage this point down toward the ankle. Now we would do this 30 to 60 times on both sides. Okay? This will start to calm the lower legs. You'll see this point used a lot in our healing. This is a major point, and it's worth a lot of study, not only for your martial aspects, but also for your healing aspects as well. Now, I would do that 30 to 60 times on both legs. I would also use a point in the front of the leg called stomach 36. Right where the knee comes down at a V, there's a space in between the shin bone and the calf muscle here. And I want to massage this downward toward the toes. Again, almost like I'm trying to drain something away from the chest and the head area. And I would do this 30 to 60 times as well. Okay. Another point we could use on the hands to further relax the upper body, but this is mainly geared toward the lower abdomen, and you'll see this later in the recipes as well, is we'll massage what's called the large intestine 4. We massage this toward the finger, and again 30 to 60 times. Now you could do this more times. It's not going to hurt the person. Less is probably not going to be as effective. So it depends on how much stress or how bad the rash is or how bad the hives is. But within one session, you can get rid of most of the problems of a poison ivy. Now, if it's all over your body, it's going to take a lot more time, okay? If you've got one area that's just starting to get poison ivy, or you've noticed your first hive, you can start to relieve yourself in a short amount of time. And it's always better, of course, to get it the quicker into it, because the more you let the anxiety or the stress or the rash affect the body, the harder it is to get out, okay? Now, one that we noticed that helps for poison ivy, other rashes like poison oak, poison sumac, whatever you have in your country, this recipe works just fine. Okay? For hives, sometimes we have to go just a little bit more. There's a pressure point on the outside of the arm, not the large intestine 10, but a point called large intestine 11. It's right where this cord of muscle comes across the elbow. We would massage this down toward the hand, just like we would do in the hiccup remedy of large intestine 10 earlier. And again, we would do this 30 to 60 times. That's how we found these recipes. We were able to induce stress by using pressure points of the arms in a martial way, and we were able to figure out how to eliminate that stress. And again, when you figure out how to eliminate stress for a technique, you can start to think, okay, what else does it affect? Is it stress from a family situation, a business situation? So it's an invaluable technique. Another valuable aspect to these healing techniques or the first aid techniques is when we practice a martial art, you can only practice so much martially. I mean, you go home, you're not going to hit your wife, you're not going to hit your child, you're not going to hit your friends and family. Well, some people do try, but they don't like it too much. So you can't practice as much. But when we work on, say, like healing techniques like this large intestine 10, who's not going to let you make them feel better? Okay, you can get your practice on the nerves to find these nerves. Someone has hiccups, you grab their arm, say, hey, I can do something for you, and you can heal it. But more importantly is you start feeling the nerve structures. This healing will help your martial art considerably. Your martial art will help your healing considerably. And that's that duality again, the yin and the yang that's been missing from martial arts for so long. And that's what we're trying to bring back today. Now, we have a recipe for headaches. Now, people get headaches in two main parts of their head. They're either going to be affecting the side of their head, maybe their eye, the side of the back of the head, or it's going to be a headache in the center. Now, we found these headache recipes because we strike the head with Kyusho points, as you've seen in many a film, okay? And you've seen us do this headache recipe a couple times in some of the prior DVDs. All right, unfortunately, I'm going to induce a headache, and I'm going to induce it in the head. And what I'm going to do is, for headache relief, for a central headache. Now again, I want to say this one more time. You can get many people get headaches, okay? Millions of people get headaches. How many millions or hundreds of millions of dollars are spent each year on aspirin, Advil, Tylenol? There's nothing wrong with those medications. They do help people. But they take 15, 20 minutes for them to relieve the headache. It's also another chemical in your body, okay? And over time, what does aspirin do to your stomach? What do these other drugs do to your body? So that's why we find that these Kyusho natural healing techniques are much more valuable. You can help your friends and family in mere seconds as compared to minutes, okay, and you're not poisoning the person at the same time. And a side benefit, you're going to get better at your martial art as well as you will get better at the healing, okay? So I'm going to cause a central headache, sorry. Okay, where does that hurt? Okay, sit down, sit down. Okay. I just want to get rid of some of the dizziness that he was feeling on that. Now, you've seen me do knockouts with less pressure, okay? And the reason why I didn't knock him out is I hit at the same time, same pressure. As I've described in prior techniques, that doesn't work. But what it does do, and what we found by mistake, okay, is it does give the person a headache. He's not going to want to train with me anymore for that whole night, so I've wasted my time, okay? So what I want to do is I want to heal him correctly. Now, you said you had your headache where? Right there. Because I hit both, it just rushed to the middle. So what I'm going to do is, if you can turn sideways. Yes. Okay, there are two pressure points right at the base of the skull called bladder number 10. What I'm going to do is I'm going to actually push pain into the head more, okay, and then quickly release it. It's like a plunger in a sink. You don't just try to push the plunger one way, you push and pull to dislodge that pain. Now I'm going to do this 3 times. Okay. At that point, I'm going to take 2 fingers and run them down either side of the spine to activate all the nerves that come out of the vertebrae. Now I come right to the corner or the bridge of the nose, right at underneath the eyebrows, with a light flick. Is the headache gone?
It's gone.
It's gone? Okay. All right, turn toward the camera. That's how quick you can eliminate a headache. Now, if a person has a migraine, it takes a little bit more, okay, but it still works on migraines. I did not give him a severe headache, I just gave him a mild one. But we've hit each other very hard and given each other severe headaches. We know people in our family base, our friend base, that have had severe headaches, and we've been able to take headaches away. And one of the most remarkable things that we find is this, more than any other recipe. People email me all the time or call me and tell me these stories about when they're at their office or they're at home. And they help coworkers, they help family, they help friends. Someone has a headache, they get to practice at the same time as they're helping one of their friends alleviate themselves of this pain. Again, this is for the central headache. We worked on the bladder 10s in the back of the head, the 2 stripes down the spine to activate all the nerves coming out of the vertebrae, and also at the 2 bladder 2 points on the front of the head. That's a central headache. Okay, now for a lateral headache, something that occurs on the side of the head, whether it's by the eye or whether it's in the base of the skull, it's the same area. Okay, so we're going to do the same technique on any of those. So you only have to remember central headache, lateral headaches. Now we found this, some nerves in the head, like the stomach 5 I just showed you for the central headache, will cause for some reason the pain to center in the middle. We don't know why, it just happens, and it's just observation and experience that led us to find this. We found, though, that the points of the neck, gallbladder 20, large intestine 18, stomach 9, tend to cause the headache more in the side. So I'm going to induce a small headache, and I'm also going to revive it. So by doing large intestine 18s, okay, sit down, sit down. Where is your headache? Okay, right at the corner of the eyes. This time I'm going to use gallbladder 20s and push and release. 3 times, much like you saw on the central headache. In fact, I know there's a muscle knot right in the back over on this side. I'm just going to work that just a little bit more. Your hands get a sense of where these headaches tend to go. At that point, I'm going to take from the 2 gallbladder 20s right at almost at the base of the skull, about an inch away, on either side, push down, drag to gallbladder 21, and quickly pull off to the sides. We do this 3 times. We always do things in 3, and I'll explain a little about that in a second. Then at the corner of the eye, gallbladder 1, quick light flick. Okay. Now is it gone?
Yeah.
So
fine.
it's all gone?
Yes.
Okay, where did you feel your pain again?
Where?
Yeah, where did your headache go?
Basically, it comes first, rises to the corner, like 2 horns, similar.
Yeah.
It's just here, and pressure here. Just doing the gallbladder 20s releases a lot.
It released a lot of it. That's good. He developed a muscle knot in his back. Now, here's a side benefit of doing these techniques and these recipes. You develop a sense of the body, a sense of where the body's in trouble. Like this muscle knot, I found that, and I worked on it just a little bit more to release it. Because if you have a muscle knot, it's squeezing on the nerve tissue around it, or it's disrupting the nerves, and that can sometimes cause pain. So if you're at a typewriter or a computer all day, a lot of people get headaches from the visual stress of the screen. They get it because their arms are in a bad position. They have bad ergonomics in their office space. They develop headaches because their muscles are bunched up, or their muscles are knotting, and it's putting pressure on the nerves. And that's what develops a lot of headaches. And that's why we get a lot of stories from office spaces where people help their coworkers, because at work, I mean, you do have stress. You do have these bad situations where you're in bad postures. But you saw how quickly that relieved that headache. If you develop a headache on your own, not from someone slamming you in the neck, but just develop a headache for whatever reason, tension or stress or just something you ate sometimes can trigger some people's headaches, okay, you can relieve it just that quick. In keeping with the head problems, let's go to the sinus. A lot of people have allergies. A lot of people have sinus buildup, especially in the winter. Everybody gets a cold, their sinuses fill up, they get constricted, you get a sinus headache. There are certain things we can do to open up the sinuses. Right now, what I'd like you to do is right on either side of your nose, okay, is place your fingers right where you feel the indentation of the nose bone meeting into the cheekbone. There's a pressure point here, okay? What I would like you to do is with both fingers is press in firmly and hold for about maybe 10 seconds. Now it hurts. You have to go through this a little bit of pain for a second. Now quickly release, and you should feel your sinus cavity open up. That's one aspect of the sinus relief, okay? Another aspect is to press at the lower aspect of the nose, right where the nose comes into the crease of the face. That's large intestine 20. You want to press firmly and hold again for about 10-15 seconds. Quickly release. That will release the lower sinus cavity. Then to go up to bladder 2s, you're going to press up and in firmly and hold that for about 15 seconds. You quickly release that, and you'll feel that the upper sinus relaxes. It's most important to go to the center sinus first, the main cavity, okay? And then you can go upper or lower. It doesn't matter which one you prefer. You'll find out over time that if you have to do this a lot for yourself because you have allergies and you fill up a lot, or you get congested a lot, you'll do this on your own a lot. This is another recipe you can do for yourself. Obviously, the headache recipes you just saw earlier, you can't do for yourself. But this one you can, okay? We have people that have had allergies all their life, have weaned themselves off allergies. We had one lady in South Africa just recently. She said, since I was 16 years old, she was an older lady. She was in her 40s, 50 years old. She said she's had them since she was 16 years old. Nothing worked. She'd have temporary relief from the sinus medications and whatnot. She started practicing this recipe, and all of a sudden, after about maybe 6 months, she wasn't getting them as frequently. Then after a year period, she wasn't getting them at all. We have these stories coming in all over the world, and it's truly remarkable, and it's actually a benefit, I think, we found that you don't have to take these drugs. We can relieve these symptoms without the drugs just naturally. Okay, let me show you how we found this, though. Again, we were doing martial arts techniques. We were learning how to seal the breath. One way we learned to seal the breath is a pressure point right up under the chin. We press this, and that makes the back of the tongue actually swell. It swells the throat a little bit early, as we depicted earlier as well. Okay? Then we pressed on the top of the nose, okay, and that sealed the sinus cavity. And after you get this technique, you can't breathe, okay? It's a very stifling technique, okay? But after a few minutes of doing this, your sinuses just clog, they compress, they get congested. So we had to find a relief for this because people were getting quite annoyed. All right, to do this technique, okay, is I'll pull my middle finger right up underneath, and that will like fatten the tongue. And then I compress here. You okay? You stuffed? You congested?
Oh, all up in here.
Look at the camera. If you can zoom in on his eyes, you can see that there's something going on up around here. Now we're going to release this by pressing and holding, which isn't a pleasant feeling. It does hurt. And quickly release. Yeah?
Better.
Yeah. And you can even hear him breathing a little better. Now the bladder twos.
Wow.
Good. Now if you have allergies, okay, now explain the feeling before I get into this next explanation. Explain what happened when I compressed.
Grabbing up underneath, it just felt like my whole mouth was closed off. You could feel the tongue just fatten up. But grabbing up in the pressure up in here, it just felt like the whole top of half of my head clogged up.
Hmm. And after I released, was it still with you?
After you released the grip, yeah, it was still with me.
The pressure.
Right.
Yeah.
Okay.
Right.
And this opened it up?
That opened up. That my eyes were a little bit foggy, but pressing into here and releasing started to get my vision back a little bit and started to drain it down.
Sometimes if you're doing sparring, for example, in your martial art, you'll tag someone either on the side of the nose, you'll tag them right on the bridge of the nose, maybe off to the side, and they develop that congestion. This is an excellent way to relieve that. Okay, I don't suggest you do these techniques. We do them, and we had to find a relief for them. But I just want you to know that it will work for allergies, it will work for common sinus congestion, and it even helps with sinus headaches. If you have a sinus headache, you're mainly going to get it in the center. So you're going to want to use that central headache recipe that we used, but before you do that, you want to open up the sinuses, because if the sinuses are still closed and you relieve the headache, it's going to come right back, or it's going to be hard to relieve. So open the sinuses first, then relieve the headache. So that was for sinus pressure and sinus headaches. Okay, this next recipe we're going to work on, we call it the asthma relief. It's our fourth level of remedies. We have a healing system, much like we have a Marshall system, built in levels. And they train the person on what they need at that current time. Our curriculum is built in the fact that we do the revivals first, so just in case something happens, we want people well-versed in how to revive a person. Then our next level of our Marshall skills is working on the arms. And that's when we started moving into the anxiety relief. After that, we target the head. That's why we needed head reliefs. Okay? Now we start targeting the body. Okay? In this, we needed to release the upper congestion that happens when we constrict the bronchial tubes. Now, I've explained on prior DVDs how to seal the breath. One way in particular to seal the bronchial tubes, not spasm the diaphragm, but to seal the bronchial tubes is by hitting in certain pressure points on the upper body. Okay, kidney 27 in fact is one of the best ways to close off the bronchial tubes. It'll feel like you've either got a very bad cold, or for people with asthma, when you get that constriction and that hardness in breathing, okay? The bronchial tubes are constricting. We have the remedy to open this up, and that's what this technique will mimic. Before I do that, let me explain how I'm going to help him, because I'm not going to explain it as I'm helping him. I don't want him to not have or have trouble breathing for a long period of time. On the heart relief, or the chest constriction, what happened was I showed you on the right side, right at where the scapula is, there's a pressure point called bladder 15. On the heart constriction, you always use your right hand on the right side only, okay? We found that it does not relieve as well on this side. You could also cause further chest constriction by hitting on this side. But when you're fixing the lungs, we found, or the bronchial tubes, we found that the left-hand side is the one that works the best. It's also, funny enough, where the muscles will knot in the back when we do one of these techniques. Also with a person with asthma, okay, if you feel an asthmatic's back, okay, especially if they're more severe asthmatic, have more severe asthma or asthmatic attacks, you'll find that the cord of muscles at the thoracic 1, 2, and 3, those are the big vertebrae that starts the back, okay, these muscles will be very tightly knotted. Sometimes you can even see they're a little more distended than the other side. Those muscle knots need to be released to release the pressure on the nerves there. For some reason, that controls the constriction of the bronchial tubes. So we need to open them. How we do that is at first, especially if the person's got a severe constriction, is we'll thump it. Okay? And we'll open it up. We'll start relaxing the muscle almost like you're tenderizing meat, okay, to cook. And then we'll massage to make sure that that muscle relaxes, okay? Now, before we go into that technique, I'm going to explain a story. When I was running a martial arts school as a full-time instructor for 20 years, I noticed that the children, every once in a while in the beginning years, okay, you'd get one child that had asthma, okay? They'd come in with an inhaler. The parents would tell you they need to stop, they need to stop. They have to go over and get an inhaler to relieve their asthma. When we found this, by the time we found this recipe or remedy, okay, I noticed that 50% of the children in my classes basically had some level of asthma. Not everybody had the sprayer to open up the airways, but the kids would have to stop, they'd wheeze. Whether it's our pollution, whether it's the hormones in our food nowadays that's causing more asthma as our society grows, I don't know. But I've observed this over the last 20 years. But as we developed this asthma recipe, okay, we started using it on the children. Now I'll show you how to do it on a child that's a little less strong than doing it on an adult. But we've actually gotten kids to the point where we've weaned them off their inhalers. Again, do you want your child spending the rest of their life taking inhalable drugs or inhalable chemicals? Okay, or do we want to try to work a more natural way of doing this? Now, go back to the recipe. The way we found this, okay, is by striking points like kidney 27. When I strike this, I'm going to strike it down and in at a 45-degree angle. Take a deep breath again. I want you to feel that constriction. He's having trouble breathing. Do you see the calming? As soon as I struck, you saw the body calming. Are you okay? Okay, I was going to stop for a second and ask him to take a deep breath, but I think I hit him pretty good, so he was having a lot of trouble breathing. Now what this will do is if you let this go, obviously it turns into anxiety. It'll turn into a headache over time because he's having a lot of pressure. So these things are almost like stacked in layers in the way that we've produced them for the curriculum and the levels that we work all the way through the curriculum, because one will touch off the other, which will touch off the next one in line, which will touch off the next one in line. So it's cumulative. And if you think about it, it is holistic healing. We work with the whole, we work with the synergy of the body. And that's why we found these recipes, how we found these recipes, and why they work so quickly. That's the asthma relief. Our next level of healing application is for lower abdominal cramping. We found this because we started at level 5 that this is at in our curriculum. We started kicking the person in the legs and maybe hitting and targeting right around the lower abdominal region, right below the belt line. As you do that, you can induce some stomach cramp or lower abdominal cramping. And we had to relieve that person. Okay, again, kicks can do that. Low strikes into the bladder area will also do that. And how we found this is we have a target right across from the navel, right where the side obliques and the abductor or abdominal muscles end. There's a space. When you hit that down and in at a 45-degree angle, it's a nice technique. Okay, take the person right off his feet. It doubles them over in pain. Sometimes it knocks them completely unconscious. Now, we're not going to go to that level today. I'm not going to hit this hard because it does have side ramifications, which I'll explain a little bit later. Okay, but if I just strike, it's a very powerful technique. Okay. Now, to relieve that, can you explain what the pain feels like in your gut?
Yeah, no, that's just going, the pain's going straight in there and very focused and painful.
Okay. What I'm doing is the spleen number 6 again. I told you this would come up on a lot of different recipes, and it does. I'm going to first start to try to reduce the feeling that it's in his abdomen by stimulating the nerves on his ankle by pulling down toward the ankle bone. I would do this 30 to 60 times on both sides. Could you extend the other leg?
It's relieving the stress as well
from the hit.
Yeah, I just feel.
Okay. Now he got stressed again with this hit, and again, it releases a lot of emotions when you get hit. Okay. First is that shock of pain, the dysfunction. Fear follows because, okay, I'm dysfunction. Will I ever get well again? This is the kind of thinking that goes on when you get these Kyusho attacks. It's not physically damaging, but what it does is it does cause these emotional aspects and these qualities from the dysfunctions. So that's why we need to use these to calm the body down, to get it into a more relaxed and balanced state. Now, after the 2 spleen 6s, could you roll this pant leg up a little bit more? There's a pressure point called spleen number 9. It's right where the knee forms a V. You want to massage this also, and you massage this down and in toward the foot again. Now, because I hit him a little bit better than I thought I was going to hit him, okay, I'm going to do a little bit of time on him to relieve this, and I'll explain again why later.
And that's painful.
It's very sensitive.
Yeah, very sensitive.
Sometimes pressure points, if a person needs healing on a particular pressure point, that particular pressure point or nerve underneath the pressure point will be hypersensitive. Now, you could do this over clothing. You don't need to roll it up, but for the camera's sake, it's good to show these points. Again, spleen 9, right where the knee comes down at a V. We want to massage this down toward the ankle. Good. After 30 to 60 times on both sides, I then come right up to the large intestine 4. Again, this is almost like the spleen 6. This is a very versatile point. If you pick up any acupressure book or acupuncture book, you'll see a lot of recipes that they have as well using this large intestine number 4. What happened?
Wow. I belched.
Oh, okay.
No, but I'm getting relief. It feels much better. That was very painful before, and it feels relaxed there and calmer again.
And that's why you burped, is because it's releasing the tension, and that was being held, and it just released. Okay, because it calms the body. It's large intestine 4. Now, this recipe also helps in a couple different ways. First of all, for females, it does help with their menstrual cramping and their pains. Okay, it's a particularly good recipe. I will caution you that, however, during a woman's cycle, is they do get hypersensitive on these points, especially the lower ankle point, the spleen number 6. So when you go in, don't go in with firm pressure, go in with light pressure. And that's something I really haven't been talking about, is the pressure. This is something you can't explain it on film, obviously. You're going to have to go with your experience, and as you work on people, you will develop the right touch to get in with the right depth, the right feeling. But again, that also helps your martial art, because you know how deep you have to go in, or how you have to penetrate, or how you have to separate the muscles to find these nerves. Again, that yin-yang duality. Now, this technique, the one I hit Jamie with, I didn't hit him too hard. Okay, but when you do that, sometimes a person can get dysfunction. A male could get some dysfunction that goes with that. So we do have a recipe that we're working on now. We haven't really tried it on as many people as we'd like before we say this is a definite healing technique. But for the case of ED, this can help. But we do everything in the reverse pattern. Okay, we don't drain away from the body. We push the energy in. Okay, so again, this is something that we're investigating right now. We had a couple of very good results, but not enough to say that this is a definite recipe that will help in this situation. And again, how much money does people spend on the drugs for that situation, or the menstrual cramping, or even lower abdominal pain? This is an invaluable technique, as is the others. Our next level that we work on is for foot cramping and leg cramping. What we found over the years is when we get into the level 6, where we do takedowns in our martial aspect, we were doing a lot of foot sweeping techniques where we'd be sweeping the foot out from underneath the person, which needed a muscle constriction in the foot. That, and also in any athletic endeavor, you go through periods of dehydration. When you have these dehydration periods, what happens is your feet can cramp. And a lot of athletes have these foot cramps. And the foot cramps can ramify in 3 specific areas of the foot, which we'll explain in a second. Okay. One way we can simulate this, though, to give the person a foot cramp. Now, a foot cramp is either going to happen on the arch, on the sole of the foot, or on the outer aspect of the foot. How we found these is by kicking these pressure points in the leg. Now what I'm going to do is, could you lift this pant leg for 1 second and turn toward the camera? Okay, right where the muscle ends, there's 2 pressure points, okay? They're on the stomach meridian. Now these 2 pressure points, when kicked up and in at a 45-degree angle, will make this contract over here. But when this muscle or tendon contracts, what happens is it starts pulling on the outer aspect of the foot. So we found a relief for this aspect, or this part of the foot, when the person cramps in that location. That has a lot to do with dehydration as well. A lot of people that run, for example, at night when you're trying to sleep, you'll get this problem. Okay. Now if I just kick up and in, okay, I'm going to tap. Okay, take a seat. Okay. Okay, now the toe is separating a little. You can start to see that they're flailing out. Do you have a little tightening here?
Yeah, it's going down here to there.
Okay. Now to relieve that, what I need to do is I need to get down to the part of the foot that's being attacked the most, and that's going to be the belly of the muscle. Before I do that, I was just lifting the big toe to show you that this whole muscle here is what you have to work with. The belly of the muscle is right on the pressure point underneath here, and I press in very firmly and then quickly release. I will do this 3 times. Then at the tip of the toe, we're going to pull 3 times. Now this just reminds me of something I really need to say. A lot of books tell people, I'll work on this foot while we're doing this, sorry. Okay. There's a lot of books out there that recommend recipes for expectant mothers or pregnant women. And my advice to you is, after seeing all this happen, okay, with bodies and the way pressure points affect certain functionalities of the body, on an expectant mother, I would not touch a pressure point. I know there's a lot of people that are going to have a problem with me saying that because they've done it for years, that are safe and stuff. But after seeing what we can do to the body and after the ramifications that we've noticed through these experiences throughout the years, I just wouldn't place that amount of risk. Also, in Chinese acupuncture, the bladder 67 point at the tip of the small toe is supposed to be a point for unbreaching births. Okay, so if a pressure point way down in the toe can do something to a breached birth, okay, imagine what the other pressure points on the body could do. Okay, now I do have a recipe for nausea, which pregnant ladies get into a lot. They have a lot of nausea. I will show you how to do that with an expectant mother, so it's not invasive like this is. Okay, has the muscle cramp relaxed?
Fine.
Okay, that's good. Now we found that through just muscle cramping at night. And we found how to relieve that also from doing kicks. Now, if I kick the inside of the ankle at the spleen 6 that we've been healing with for the last 2 recipes, it's going to cause a cramping in the arch of the foot. Okay? And a lot of people get this cramping. This one, you want to work with the belly of the muscle right underneath. You press and quickly release. Now, the cramp, the cramp will go away after a prolonged period of time. This is the 3 times is not going to heal these cramps. It's going to relax them, and I pull on the big toe, excuse me. But what's going to happen is over time as I do that, that will relax the muscle. Each time I do it more and more. And how bad your cramp is how long it's going to take you to remedy that situation. So that would be for the inside or the arch of the foot. For people that get the cramping on the inside middle of the foot, the sole of the foot, we do about the same thing. We're going to go right to the belly of the foot or at the kidney. It depends on kidney 1 point. It depends on where your cramping starts. On the sole of the foot, there's a little bit more diversity in the point you could use. You're just going to have to figure out for yourself whether you feel the pain more up toward the toes or down into the middle of the foot itself. Again, you press and quickly release 3 times into the belly of the muscle. Or you go up to the kidney point 1, which is the end of the muscle on this particular one. And then you'll pull the second toe, and that will relieve the inside of the foot. Okay? So this recipe is very nice for the foot cramping. But here's where the real beauty lies. That same type of action, that same type of healing recipe that we used for the belly of the muscle and then pulling on a distal point will work if you get calf muscle cramps or if you get a hamstring knot. Instead of just like trying to rub it out, what you need to do is, say he has a muscle cramp on his calf is knotted up. You go right into the knot and you press in. Now it's going to cause an extreme amount of pain. You hold it as tight as you can and then quickly release 3 times. And what that does is it's almost like the plunger we did on the headache, is it puts a little bit more pressure, and as you release, the muscle relaxes a little bit. And as the muscle relaxes, it takes the tension off the nerves. The nerves are able to communicate a little better, and everything starts working and relaxing as it should. This will work on the hamstrings, this will work on the calves, wherever you get cramping. Okay? So that's an excellent recipe to learn about. Now, again, these recipes work in many different levels of functionality. Earlier, I was showing a recipe for releasing abdominal cramping. Okay, this also worked for the menstrual cramps, as we stated. We're working on the ED for men, but we've also noticed that it works on something as common as restless leg syndrome. Some people can't sleep at night because their legs vibrate, or you see someone sitting down, their knees or their feet are always jumping. It's just the restless leg syndrome. And these people lose sleep over it. It induces more stress. The same recipe that we did for the menstrual cramping or the lower abdominal cramping will work on the restless leg as well. So these are not just for specific cases. This is a tutorial, hopefully, to get you an education so you start learning the manifestations that happen in the body. So no matter what kind of problem a person has, you can relieve a little bit of their anxiety or problem that goes with that. Okay? And hopefully over time you get more experience, you get better at it, and you can heal more issues. We have one now that's for nausea. Okay? And I was mentioning on the last segment that pregnant women get nauseous. Okay? And I also recommended that you shouldn't do pressure points for nausea or for anything on a pregnant woman for that matter, because you just don't know what kind of dysfunctionality it's going to cause in her body. And when you have a baby and the mother at risk, you just don't take that kind of a risk. All right. The pressure point, the main pressure point that we use for nausea is a point called pericardium number 6. Pericardium number 6 is in between the tendons of the hand. It's on the median nerve. Okay. Typically, we would massage this point down toward the hand. Okay. Just like we did on the spleen number 6. Okay. And that will release the stress on the stomach. Now, I'm going to induce that in a second, but I want to explain a couple things. There's another pressure point that some people use that's pericardium number 7, okay? And you can also massage that the same way. Now, in an expectant woman, you don't want to be pressing into the nerves, as I mentioned, because it can cause stress, it can cause more anxiety, or it can cause some dysfunctionality. You can place an ice cube on this part of the arm at the pericardium 6 or 7. And that will relieve some of the symptoms of nausea as well, because ices are very cold. It makes a contraction, and as it contracts here, it pulls the stress away from the inner core of the body, because there's something going on here that the body has to address. So that's a mild way that you could do it with an expectant mother. Now, if you also travel a lot, you'll see in airports, you'll see a rubber band, and they have a bead, and it's used for travel sickness, okay? These two areas, when you get nauseous from travel sickness, okay, can relieve the issues as well. Now, you can buy one of those rubber bands with a bead, typically around $17 to $20, okay? Or you can sit on the plane and just massage your own wrist, okay? Much easier, much cheaper, and you can help people very, very quickly and very rapidly. What we want to do, again, is massage toward the handle, okay? Don't push up, because that'll cause more of an issue in the stomach. As a matter of fact, do you feel how your stomach feels?
Yeah.
Okay. If I push up, did you feel that go into your stomach?
Sorry.
A little bit? Okay. So what I want to do is relax that. I want to pull away instead of pushing in. Now, we found this, oddly enough, when we were grappling, okay, when we were doing wrestling. Sometimes you overexert yourself, you're compressing your stomach in different postures on the ground or up on top. Also, when we're manipulating leg points. One release I showed on my grappling video in level number 7 was a pressure point called liver point 9 to release the leg, okay? This point, if you could put this leg forward, is one hand width up from the knee. Okay, one hand width up in between the quadricep and the hamstrings of the leg. There's a nerve in there that causes extreme pain. And we released the grips on certain things like the guard or other issues that we were working on in grappling. But we also found out when we did that hard and frequently enough during a grappling session or an hour-long class or a 2-hour class, whatever the case may be, people were starting to get a little nauseous, okay? So we needed a recipe for this, okay? So that's where the pericardium 6 comes in. Now, to induce a little bit of nausea, we strike that. Okay? Well, okay. Now, I hit one side. If you hit two sides, it's even worse, okay? Now, whereas the coloration on one individual went from white to red, if I let this go without healing, okay, and I should have, but we'll work on it now, he would go from the opposite way. He would turn whiter, okay, because the blood pressure goes down. Sweating? You can get the cold sweats, yep. It's just like you got a flu. It's much what you're going to feel if you tag both large liver 9s very, very well. Okay. Now, is this relieving it a bit?
It's better now, yeah. Relaxing.
You still have it, though?
Still?
Still have a little bit.
It's relaxing a lot.
Okay, good. I just go to the other side and do it on both sides. Again, 30 to 60 times, depending on how well I tagged them, or how many times or how many repetitions. Now, I first found this recipe working out with a child. I was teaching the kid liver 9 for self-defense. Being a child, they're able to kick very well because they're flexible, they're quick, and they're low. It's a great target for a child. Well, I had a half-hour private lesson with the kid, and I was letting him kick me in liver 9 to get me dropped on the floor. Well, stupid, but it was early on in my career, so what did I know? I let him kick me for the whole half an hour, and the kid went off. He was all happy as all get-outs because I was on the floor more times than he was, and he was laughing all the time. So anyway, I started teaching classes, and 2 hours into my teaching, it just wiped me out. I turned completely white. Everybody freaked out in the class because they didn't know if I was dying or not. I was sweating profusely. And I went into the restroom. I excused myself. I was going to get sick. And I just went in there to make sure that it didn't happen in the dojo. What I did was I searched back through my memory for a technique for nausea. And I had an experience. I had not an experience, but experience as a shiatsu practitioner, also as a tuina, which is the Chinese acupressure. It's where my history comes from, okay? And I did healing professionally for a while, and I had stopped it to replace it with the martial aspects. So I remembered that this technique was given for nausea, and I started working on it, and it worked instantly. And from that time on, anytime that anybody got nauseous in the dojo, we'd use this technique to relieve it. So that's pericardium number 7, pericardium number 6. This level is our level 8. What we found with this one is we do tuite, joint manipulations. Okay, a lot of times we'll get the person, we'll jerk the person, and we'll take them down off their feet. Now, I'm going to do this again. I'm going to show you what it actually does to the spine. This is called spinal alignment, but please understand that we're not aligning the spine. We don't have a chiropractic license. We're not trying to align the spine. We call it spinal alignment because we run along the side of the spine, and we work with the nerves that are coming out, so they're aligned with the spine, and that's why we call it this. We're not trying to line up the person's spine, and we're not trying to pop vertebrae into place or adjust people's back. That's not our focus, that's not our goal. We're actually working on the nerves outside and exterior to that. All right. Now, the reason we found this, can I use this hand actually? I'm going to show you this tuite. Many people call it different things, from Nikyu to side wrist lock. There's a lot of different names for it. It doesn't really matter. What I want to show you is why we found the need to do this, okay? What happens is when we do a tuite, I'm going to do one that actually just affects the neck and the back a little bit. You can see how that pulled his back. Now watch his spine here, okay? I'm just going to bend this a little bit more. You see how that back kicks in? Now when that happens, what happens is the muscles contract very tightly, okay? And as that happens, it pushes pressure on those nerves. All these nerves have correlations to the inner organs, okay? And that's why they're called, we use the pressure points of the old acupuncture or acupressure. And they're correlated to the spleen, the liver, the stomach. All these nerves innervate these internal organs as well. So now if there's a problem where it's being compressed and it's not functioning normally, or there's stress in that area, well, they can have ramifications on maybe digestion or something of this nature. So we needed to relieve this. So I want to show you one more time. Okay, watch the back in particular. Let's turn a little bit more toward me. I want you to watch the spine as it comes out of place. Okay, sorry about that on the arm. You want to lay on your belly? Yeah, thanks. Okay, now because I caused a lot of stress here and I compressed the nerves, I want to release those nerves as well. Okay, and how I do that is I'm going to find out, first of all, okay, through checking the spine just a little bit, where he's going to have most of the problem. And I can see by using my finger on the vertebrae itself, as I draw down, my finger takes a slight jag over the side here. It's like there's a problem right here. The muscle's constricted, so my finger, it pulls the spine a little bit more over to this side. Okay, and that's how I know where that problem is, because of my fingers sort of going into that curve. All right? So I know it's here, but I'm not going to just start here and work here. I want to relax his whole spine. Now how I do that is I'm going to use the soft pads of my thumb on both sides of the spine, starting at the pelvic girdle. And I'm going to push down and up, much like I was going through that asthma relief. And that's just to put some pressure on the back of the body. Then I'm going to use my knuckles here as rolling pins to put more pressure. And this not only relaxes the nerves of the muscles of the body, but it takes the pressure off those nerves. And as I do that, that's smoothed out considerably. And I can also feel that muscle knot that was in that area has relaxed a bit as well. So this is one way to find where there's an issue in the person's back. It also feels pretty good, doesn't it? Okay, it relaxes the whole body. And the reason being why it relaxes is all those nerves are being stimulated, okay, and then massaged. So it relaxes the tension on the muscles and relieves the problems that we caused from the tuite. The final first aid techniques that we're going to describe today are for backaches. A lot of people, especially as we age, we get lower backaches from muscle tension. Some people get middle backaches, and some people get upper backaches. Now we found this because on our level 9, which is the level of healing that we do with this technique, we do what's called the knife method, or the knife defense. Some of you that saw video number 9 will see these defenses, and where someone comes in with a knife or a punch and we jump in and we bang the head. Well, as we bang the head, what happens is it causes the person to arch back and start moving. And as he arches back like that, you can see the tension that it would cause in the lower back. And that's how we found this recipe to be really beneficial for this technique, also to relieve other people's backaches as well. Okay? So as I moved into this and I move his head back, okay, it's going to cause that stress. Now if you could just stand. No, just stand. Okay? Now when that stress is in the lower back and the muscles tighten, what I need to do is I have to go to a distal point to relieve it. Now we found that a point on the lower ankle called bladder number 60, in between the ankle bone and the Achilles tendon, and on top of the heel itself, there's a nerve that we can easily access. We rub this down about 60 times. And what this does is, oddly enough, it relaxes the lower back muscles. So even if you didn't get put into that position, if you just wake up in the morning and you have backache like many older people do, okay, this remedy works great. Now this is one you can't do for yourself, because if you bend over, you put more stress on the back and you can't reach it. If you're sitting down, you're in an awkward position, it won't work as well either. Someone else has to do this for you. Okay. But just working on this 30 to 60 times will relax those muscles, and we do it both sides, and that will relieve the lower back tension. Now, some people with sciatic nerve problems, okay, also have pain, but it emanates from the back. It doesn't emanate from a problem in the leg. There's a nerve in the back that's getting compressed somehow. Why, I don't know. It could be different manifestations. But that causes pain either down the back of the leg, the side, the inside of the leg. It's called sciatica because it's pinching the sciatic nerve. This recipe really relieves a lot of the pain of the sciatic nerve. Now it's temporary because you have that issue up here, a physical issue that's going to keep causing that sciatic pain over time, unless of course you get it medically treated. But if you don't want to take the drugs, if you don't want to take aspirin, or maybe the aspirin or the drugs are not working, this is an excellent recipe for taking away that pain. Okay? There's more to do with the sciatic nerve, but that's not in the scope of what we want to train right now. For those of you that have the mid-backaches, women have this a lot because of the way they carry maybe a heavy bag on their shoulder all the time. There are different reasons why people have mid-back problems, okay, or stress or tension that need to be relieved. To address the middle back, you should address the lower back recipe first. By releasing the muscles in the lower back, the muscles in the middle back will also release. But to get some extra benefit from it, there's a pressure point right in the middle of the spine called bladder 16. These bladder 16 points must be pressed in toward the spine and held firmly and then quickly released. To do this without the pressure of a wall, if he was putting his hands against a wall, I could release both of them at the same time. But if not, I'll go from one side to the other. And just manipulate those muscles until they relax by pressing in firmly and then quickly releasing. Now we've done the lower back, we did the middle back. If you have problems in the upper back, shoulder, or neck area where there's also tension, or maybe even in the trapezius muscles, this next recipe will help, but keep in mind you should do the lower back, the middle back to relax all these muscles so that these will relax more. Okay? Now there are pressure points called triple warmer 15. These are the first ones we're going to address after doing the lower back and the middle back. Let's turn some more sideways. Using my thumbs, I'll push down and in and hold for about 15 seconds and quickly release. I'm going to do this 3 times or more if he's got more tension and needs it. Now up on the top of the trapezius muscles, much like the side headache technique, is a point called gallbladder 21. I'll apply the same pressure and pull off to the side quickly to relax those muscles as well. And there's one last pressure point to work with this, and that's right in the middle of the scapula. There's a pressure point called small intestine 11. Now, if he was laying down on his stomach or on a bed, massage table or something, I could get both of them. But by pushing both of them, I'll just push him off balance, so I can't do that right now. So I'm going to do one at a time. So I'll push in and quickly release. Again, 3 times. Now, notice the hand position I just made, okay? That's just to get in firmer on that group of muscle because it's over the bone, it's very tough. Some people have frail fingers, okay? Women especially, they might have longer nails. If you do this, you don't want to be healing with your fingertip this way because you might bend the nail back or break the nail, or maybe you don't have the finger strength to do that. So all of these healing recipes, you don't have to necessarily use with your fingertips. You can use them with single knuckles. Okay? They even make massage tools where they have a T-handle that you could use to manipulate these pressure points. I find, though, that if you can, your hands, thank you, have a certain empathy. You will feel certain things, whereas if you use an instrument or maybe a knuckle, you won't be as sensitive, or you won't feel what the manifestations in the body really are, or the muscle knots, how tight they are, because you're using a harder object with less sensitivity, or you're using an inanimate object with no sensitivity. So you want to make sure that you learn how to train with your fingers, okay? But at the same time, if you can't because of finger strength or the length of your fingernails for certain techniques, you might want want to use knuckles or another object. But those are the 3 levels for the back aches and the back pains and how we found them. You have 3s in everything. It's a universal factor. We have in the martial arts, we have the mind, the body, and the spirit. You have the Holy Trinity in some religions. But if you look at it on a more physical aspect, just look at your own body. Your fingers divided into 3 sections. Your arm is divided into a hand, a forearm, and an upper arm. You have a head, a torso, you have your legs. The legs are the upper leg, the lower leg, and the foot. So everything is moved into 3s. So there's a reason why 3 is important, okay, as a minimum. You always want to cover the minimum, okay? If you do it longer or you do it for a greater number of times, there's not going to be a health issue with that. Okay? Again, these recipes can be very quick, and the more you experience them and the more talent you get with your hands by helping more people, the better you get at that. And again, for the duality purpose, the better your healing gets, the better your martial arts get. The better your martial arts get, hopefully, the better your healing gets. But you should really tackle both subjects, okay? Not just for revival prospects for someone that you caused dysfunction, physical dysfunction, or altered states of consciousness, but also for the fact that you can help family and friends. Okay? That's our Kyusho First Aid. I want to thank all my instructors that have come from different parts of the world. A lot of times you have your martial arts students, and your students work with you time and time again. Now, these are all my students. We do travel a lot in this organization, and we do get around and make new friends and whatnot. But we want you to know that this Kyusho is being spread throughout the world. It's in several different countries. We have affiliates in over 20 countries right now, and it's spreading more and more each day. It's a very good technique for martial arts. It's an excellent technique for healing, and we do train people in both because we don't believe that martial arts should be just one way. It shouldn't be all strong. It shouldn't be all destructive. It should be calmer, and it should be more constructive as well. And the martial arts are the yin and the yang for so long that they got separated. In the beginning, the old master of the town was also the doctor. Somehow, somewhere in history, that got separated, and as we go on with society, it gets farther and farther from each other. What we're trying to do with the Kyusho and the investigation of the human anatomy is bring these 2 methods together to form one unit, okay? And it does help, and it augments the other. So I urge you to look into your healing as well as your martial capabilities. And again, I'd like to thank these fine gentlemen for coming. We have Xavier Villa from Barcelona, Spain. We have Jamie Evans from Massachusetts, USA. Gianluca Frisan from Monfalcone, Italy. A Cecily from Massachusetts, USA as well. And Ben Jenkoglu from Darmstadt, Germany. And thank you.